Hi, my name's Kimberly Beatty. I'm the Clinical Director at Kemah Palms Recovery. I want to talk to you today about the current situation with the COVID-19 pandemic and how the quarantines and recommendations of social distancing can impact those in recovery from alcohol and drug addiction. One of the most significant features of addiction is the profound sense of isolation that's associated with it. That makes social distancing an especially difficult and oftentimes risky proposition for those who suffer from substance use disorders. Recovery for addicts depends on breaking out of that social isolation and becoming a member of a recovering community. Now our political leaders and the CDC are encouraging social distancing for personal safety as well as being the socially responsible action to take. That creates a challenge for people in recovery from addiction because now they need to find ways to intensify their program of recovery during this time and not isolate. The social distancing and quarantine measures that are being implemented, I know, are to preserve lives during this pandemic, but it also creates a double-edged sword for those suffering from substance use disorders. Social distancing doesn't have to mean distancing from socialization. We can change that language. I think in recovery, we need to use physical distancing, not social distancing. We can find creative, purposeful ways to continue socialization and connection for the maintenance of our recovery programs. In isolation, worries and stress are only magnified, and so it's no secret that isolation is really challenging for those in recovery. Support and accountability are necessary to stay on track with your recovery program. I want to talk to you today about several ways that you can be creative to continue your socialization and your connection for the maintenance of your recovery. I think it's really important to have a structured schedule. Another really important thing as a part of that schedule is don't watch too much news. Watching the news all day is only going to increase and intensify your fear. Perhaps you put a certain time on your schedule that you're going to watch the news. I'm only going to watch my local news today. You want to include in your schedule connection with a meeting, connection with your sponsor, connection with your family, maybe some time to read literature every day. Create routines, morning routines, evening routines, where every morning I get up and I do a certain routine. Perhaps I read out of a meditation book. Perhaps I pray. Perhaps I try to meditate. And in the evening I review my day and maybe call my sponsor and see, just process how my day went. We can find creative ways to stay connected. Most home group meetings are providing Zoom meetings. Ask someone in your home group for the meeting ID and password. Go online, look up speaker meetings. There are lots of them on YouTube. There are also lots of guided meditations, mindfulness apps, ways that we can stay spiritually connected during this pandemic. Finally, don't be afraid to ask for help. It's okay to call and say, man, I'm really scared. The fear has gotten a hold of me and I'm scared I'm going to go back to my old coping skill of drinking or using. Reach out, let someone know where you're at. Reach out to your family. For those of you that have loved ones in recovery, call them. Ask how you can be helpful. Ask them if there are certain times of day that their cravings are increased and you can be intentional about calling and checking on them every day at that time. Remember, it's physical distancing, not social distancing. You can still meet your friend as long as you maintain the 6 feet distance between you. Some friends and I actually did a birthday drive-by for a friend this past weekend. We were all socially connected, but we were physically distant. It was really, really heartfelt and very special. Be creative with ways that you can still stay connected. Lastly, I do want to provide some crisis hotline numbers. There's the National Suicide Prevention Lifeline. That number is 1-800-273-8255. In Galveston County, there's a crisis hotline provided by the Gulf Coast Center. That number is 1-866-729-3848. In Harris County, the crisis hotline number is 325-486-9292. You can always go to the NAMI website They have lots of resources there for those in recovery as well as family members. Finally, if you're struggling and you really need help, Kemah Palms Recovery, we're still providing services. So give us a call if you need help. That number is 713-568-1210. Stay safe, stay well, stay connected. Thank you.